Welcome to the I Am One podcast. On today's episode, we're spotlighting PSI's Perinatal Psychiatric Consultation Program, an incredible and free resource. Did I mention it's free? For medical providers supporting folks in the perinatal period. To do so, we're bringing in an expert. We're sitting down with the awe-inspiring Dr. Nicole Taylor, a psychiatrist specializing in perinatal mental health, who, among many other roles, serves as the medical director for the Psychiatric Consultation Program and as an executive member at large for the PSI Board of Directors. Dr. Taylor answers all of our questions about this program, so if you know a provider, if you are a provider, or if you're just interested in learning more, sit back, relax, and enjoy this special PSI Resource Spotlight.
Well, pod friends, we're doing something a little bit different today. We are talking to Dr. Nicole Taylor about the Perinatal Psychiatric Consultation Program. That's a lot of words. It's a very important program here at PSI, and we want all of you to learn about it alongside us. So let's jump in. Dr. Nicole Taylor, tell us a little bit about yourself.
Well, hello, everyone. I am Dr. Nicole Taylor. I go by Nicole. That's the preferred middle name. My preferred pronouns are she, her, and hers. I am a board-certified psychiatrist with an expertise in perinatal mental health. So that means that I focus on diagnosing and treating mental health conditions that occur during pregnancy and postpartum. I've been practicing psychiatry for approximately 20 years, started receiving additional training and experience in perinatal psychiatry in 2014. So it's been a little bit over 10 years. I received my perinatal mental health certification, or PMHC, from PSI in 2018. Yes, whoop, whoop for the certification.
Yes.
I've been married for 23 years. To my wonderful husband. I have two amazing children, a daughter who is 20 and a son who is 16. I currently live in Jacksonville, Florida, where I am employed by the North Florida, South Georgia VA health system and affiliated with the University of Florida. Thank you for having me today.
Incredible. I mean, I don't know if Dr. Taylor's qualified to talk about this program. Do you? I'm kidding.
I don't think we're qualified to talk to Dr. Taylor.
Well, thanks for that introduction, Dr. Taylor. I was wondering, could you tell us what exactly is the Perinatal Psychiatric Consultation Program? Do you have an elevator speech prepared? Like, let's hear about it.
Yeah, of course. Okay. So the Perinatal Psychiatric Consultation Program is a free program that is available for medical professionals who are prescribers, and they have questions about mental health care related to pregnancy and postpartum. For instance, a majority of our questions are about medication safety in pregnancy or breastfeeding. We can answer questions about medications for women who are planning to become pregnant also, which is known as preconception planning. We often are asked about medication changes because perinatal mental health disorders are complicated and medication choices are not always straightforward or immediately effective. We have experts that can help with any of the perinatal mental health disorders, including depression, anxiety, obsessive compulsive disorder, PTSD, bipolar, and psychosis. We also have experts that are knowledgeable about ADHD, substance use disorder, fertility challenges, etc. So we're a group of experts who want to share our information with you, basically.
That's incredible. Wow.
This is so cool because I'm thinking about the number of people who I have interacted with in the course of this work who've said things like, my doctor told me that I couldn't take X while breastfeeding. My doctor told me to go off Y while pregnant. And what you're saying is these doctors can use this free resource to best provide care to their patients.
Exactly. That's right.
Wow. That is cool.
I love it. Okay, so who volunteers for a program like this?
Well, our program is staffed by experts in our field of perinatal mental health. These are all members of Postpartum Support International. They are specialists in their area. So these are the pioneers or the thought leaders in the field of perinatal mental health. These are the people who are doing the research, writing the books, and teaching the next generation of medical providers. We currently have 26 active volunteers, including 22 perinatal or reproductive psychiatrists, 2 nurse practitioners, and 2 fellows from a reproductive psychiatry training program.
Wow.
And I do want to take the opportunity, of course, to say thank you to all of the consultants who are taking time out of their very busy professional and personal lives to provide this invaluable service for free to their medical colleagues.
Yeah. Yay. Round of applause for everybody on the other end of the line there, providing feedback to other providers. So that's really incredible.
I just want to highlight this. So you're saying that the people who are volunteering for this program, even though I love my psychiatrist, unless my psychiatrist is a leader in, an expert in, has a specialty in a particular discipline within perinatal psychiatry, that's who we're looking for this, right? Which is why doctors who call this program feel confident.
Yes. These are the people that developed the field of perinatal mental health.
Yeah.
And so even if you have a wonderful psychiatrist or other type of medical provider who's been taking excellent care of you, they can still call and get our expertise, our support and reassurance to help take even better care of you.
That's a really great resource. Just if someone is just not 1,000,000% sure about how to proceed with a patient, then they can just call and talk to somebody else who also specializes in this and can pick their brain and make the best decision for their patients. So great.
Exactly. So I'm sure you'd like to know who uses our service.
Absolutely.
Oh, yes. Yes,
Dr.
we do.
Taylor, what types of providers use this service? Is it only for psychiatrists, or tell us more?
Our most common contacts are from psychiatric mental health nurse practitioners.
Oh.
And so these are nurse practitioners that have trained in psychiatry specifically. But we're also frequently contacted by other nurse practitioners and physician assistants. We often get calls from OBGYNs, midwives,
I was wondering.
family practice doctors, internal medicine doctors, and other psychiatrists. For instance, general psychiatrists or child and adolescent psychiatrists. We're contacted from all over the United States. The most frequent contacts this year have been from California, New York, and Florida, but we get calls and contacts from everywhere. And what's interesting is that a lot of these states have their own perinatal access lines where you could call someone within your state. But people choose to call PSI because we are the leaders of information in this area. We are very happy to help anyone who needs our service.
Shout out to California, New York, and Florida for leading the way. Man.
I mean, they've got a lot of people in those states. It's like, I'm just saying. The other states are cool too, just because they haven't had as many calls.
Yeah.
So how exactly does this work? I'm going to pretend I don't know, my midwives who were the first people who prescribed for me. If I am someone prescribing and I'm like, ooh, I'm not sure. Can they take this? Can they take that? How do I get to talk to you?
That's a great question. So recently we have automated our booking process to make it simpler for our users, our staff, and for the consultants. This also allows us to better track the information for data and research purposes. So to have a consultation with one of our experts, you would visit the PSI website, postpartum.net, and click on the Professionals tab.
Okay.
Here's where you will find the information about the Perinatal Psychiatric Consultation Program. You can view our calendar and book the next available expert of your choice at your convenience. The calendar shows up to 3 months of availability, and our average booking time is only about 3 days.
Oh, wow.
When you click on Book Now, you will be asked some information, some questions. You'll complete a form that contains your contact information, a level of urgency, and a reason for the consult with a brief description of the case. Then a consultant will call you at your desired time to discuss your concerns. The sessions usually last around 30 minutes or so. We offer flexible booking times, including some weekends and evening hours.
Wow.
Great. Yeah, that was my follow-up question. What is the turnaround time? But getting back, you said a few days to get back.
The average booking time right now is about 3 days.
Great.
Last year, it was up to 10 days, but with the changes we've made with the automation system, we've brought that down to 3 days.
Whoa.
Exactly.
Holy cow.
We're very proud of that.
So that means when I go and I'm looking at availability, I'll find something on average about 3 days out the day I'm looking.
Exactly.
Wow.
Oh, cool.
Exactly.
Dang.
And like I said, you may even be able to find weekends or after hours because we know all the prescribers who are calling us are busy with their practices and their lives. So we try to make it as flexible as possible.
I have a question that is not on our list of questions, but I know you'll know the answer.
Okay.
When somebody's looking to book an appointment, can they search by specialty?
That's a great question. When you look at the calendar, you're going to see the name of the provider that is available on that certain date and time. And it will also list their credentials. So you can see whether it's a nurse practitioner or whether it's a psychiatrist.
Okay.
Once you click into it, under each provider, if there is a specialty area that they are particularly passionate about, that is available for the caller or the person contacting us to see. We have some amazing PSI staff that are on the back end of this, and they know what our consultants like to do, know about.
Yeah.
So we can pair people and move people around if we need to.
Great.
Got it. So if I scheduled an appointment with someone who had not the area of expertise that I needed, on the back end, the PSI staff is going to be like, oh, hold on, we're going to pair you with so-and-so instead so that you're going to get your questions answered.
Exactly.
Wow.
That is so cool.
That's fancy.
Okay. I also have a question that is not on script. Okay. Is there a typical type of call? Like, are folks calling and saying, is Zoloft safe? Or are a lot of the cases that you guys are dealing with, it's like we've got something where they're resistant to these medications. We've tried this, that, the other thing, and now we're calling in the expert. Are you getting both kinds of calls?
Yes, we get the whole spectrum of questions. Some of the questions are very straightforward, like, is Zoloft safe in pregnancy and breastfeeding? But we also get some very complicated questions to help clarify diagnoses, to find out about further workups and specialty services and treatment centers, etc. So it really just kind of depends on what the person needs. We are able to answer very simple things and point you towards resources, or we can get into a much more complicated case and have to describe more information. It is important to remember, though, that this is a case-specific discussion.
Yes.
It is not a general training or education. PSI has wonderful educational trainings for all types of providers, frontline providers, specialty providers, etc. So when you're calling or contacting the Psychiatric Consultation Program, we are discussing a specific case that you want to get help with, no matter what the complexity of that is.
Right. That's great.
Well, our next two questions are similar, but different. So I'll ask both of them. What do you want patients or help seekers to know about the service? And also, what do you want providers to know about the service?
So for patients and help seekers, I think the important thing is I want them to know that this service is available and it is absolutely free for any of their medical providers. We really want to get the word out there about this wonderful resource. We would love it if the patients and help seekers would tell their medical providers about us. We're here to share our skills and our expertise, guidance and reassurance with your medical team so that they can take the very best care of you. We have not been very visible on social media yet. And there are lots of providers who may be familiar with PSI, but they may not know about this particular service. So we need to get the word out, and patients and help seekers and families can say, hey, favorite doctor of mine, have you heard of this great resource? I know you're wonderful, but I would love for you to talk to these experts and see what else can be done for me.
Mm-hmm.
So that's what I would love to share. Now, in terms of what do I want providers to know about our service? Once again, that it is free.
Yes.
And it is available to help you taking care of those people who are planning to get pregnant, currently pregnant, just had a baby, or breastfeeding. If you have any concerns about mental health conditions during that very vulnerable time, we want you to call us and discuss the cases with us. We are not an emergency service. I think it's important to say that.
Mm-hmm.
We do ask about the level of urgency. For instance, if someone is in a hospital or a crisis stabilization unit, we do put priority on those cases.
Totally.
But it's a true emergency. We want providers to use their local emergency resources, of course.
Right. Great. Well, we will put a link in the show notes to the website where people can find information all about this program. There will be a link there if you're a provider and you want to get connected to someone on the other end of the line and, you know, pick their brain about a specific case, then there will be a link for you on the website there too. So we'll have all that in the show notes. And yeah.
Is there anything else we need to know or listeners need to know?
I just want to make sure that everybody knows that, you know, you are not alone out there. We're here to help. We're here to support you. So, you know, we're literally waiting for you to reach out to us.
Dr. Taylor and colleagues are sitting by their phones, just waiting for them to ring. I'm just kidding. But yeah.
This is making me think of those like telethons. Like
yeah.
You guys are all sitting at the phone waiting for it to ring and you're like, hello. That's not what this looks like on the other side.
No, it's not. But thank you, ladies, so much for spreading the word about the program. And I look forward to speaking to some people who hopefully heard about it on this podcast.
Yeah. Tell them the IM1 podcast sent you.
Yes.
If you feel like it. I'm just kidding.
We'll give you a free discount.
We'll give you a free discount for this free service.
Yes. Use the code podcast at the entire lack of checkout.
Emily, you want to take us out?
Yes. Dr. Taylor, I am so excited that once upon a time, Dr. Wendy Davis pulled you aside and said, you know, I like what you're doing here. You wanna join the club? Because this group of people that care about perinatal mental health is vast, is knowledgeable, is diverse in the type of work we do, in the way that we help, in our own lived experiences. And I'm so glad that when Wendy approached you, as she approaches many of us, you said yes.
And I'm still saying yes to Wendy now.
Mm-hmm.
Thank you.
Thanks for tuning in to the IM1 podcast. Check out today's show notes where we'll drop links to all the important things that we mentioned in this episode. Please consider sharing about IM1 on social media and following and rating our show wherever it is that you listen to podcasts. It only takes a minute of your time and, well, that'll help our collective mission of bringing resources and local support to folks worldwide. From everyone here at PSI, thanks again for listening.